Recursion Pharmaceuticals is one of the most underrated companies on the public markets, especially when it comes to AI. In this video, I'll make the case for why I think Recursion will be successful long term, and I'll explain why Recursion is a large position in my portfolio. Let's start out with what Recursion does. Recursion's mission is to radically improve the treatment and discovery process. Right now, the treatment discovery process requires scientists to deeply study a disease and try to guess and check how to remedy that disease. However, disease and biology in general is hard to understand, and each guess and check is extremely expensive and takes years in trials and results. Recursion wants to fundamentally improve this process by making the discovery pipeline more like a T, rather than a funnel that it's traditionally been. They want to evaluate more compounds, identify failures sooner before massive investment has been poured in, and then accelerate development of those high potential candidates to the clinic. To achieve this end, Recursion has developed scaled wet lab data collection capabilities, allowing them to collect 21 petabytes of data. And since they meticulously did this in-house, they ensure that all of the data is directly comparable no matter when it was taken. To analyze that data, they have in-house one of the top 100 supercomputers in the world and data scientists working to turn that data into insight and discoveries. To aid in some large portions of disease, they have enlisted the help of Roche Genentech in neuroscience and Bayer in oncology, both massive companies that have achieved prior successes and lend compound libraries and domain-specific expertise to the partnership. Now that I have introduced you to the concept of Recursion, let's talk about, in broad strokes, how they plan to accomplish their goals of drastically improving the treatment discovery process. Recursion has developed algorithms that you can think of as quantifying the health level of a cell and the level of similarity to a different cell's current state. They knocked out every gene in the human genome and imaged them for comparison to each other, as well as in comparison to cells that have been exposed to a combination of compounds and disease models. From these combinations and perturbations, they are able to develop gene to compound to disease relationships. From these relationships, they look for diseases that may be rescued by a particular compound. That particular compound and disease pair can then serve as a hit for further research. This is their old method of search. It was slow, but effective at generating viable hits. They have now transitioned to what they call inferential search, where much more of the processing required to generate a hit has been turned over to Recursion's OS to find hits based off the 20 petabytes of collected data. More details are available in Download Day presentation, which you can find on Recursion's YouTube channel. Now let's get into the real meat and potatoes of the video and why I think specifically that Recursion will be successful. They have built in-house and from scratch a scalable, flexible data engine. Computing power is of very little use if you do not have the required data to train with. Gathering useful data requires flexibility to acquire a diverse dataset and scale to gather a large dataset. Recursion has built the data engine to fill both the scale and diversity requirements. Another factor when looking at Recursion is their desire and ability to innovate and improve on every step of the discovery and development process, and to do so quickly. The pace of innovation is the only real moat, as they will be copied if they have success, and Recursion has shown a relentless desire to improve outside of just the discovery into clinical validation and toxicity studies, as well as to improve animal model studies. This is yet another factor setting Recursion apart. Finally, and most importantly in my mind, the Recursion OS software can find from scratch medicines that we already know work today that we found using traditional methods. These medicines work using already well-known pathways that were found using regular science and a bunch of hard lab work. I reason that if Recursion can find treatments that work without having the science that discovered these treatments entered into the OS, unless there is some complex data biasing going on, or humans are so smart that we've discovered all of the medicines that work, then there are a bunch of undiscovered treatments waiting to be found and validated by Recursion with the tool that they have built. I think this is a deeply profound realization that hasn't quite taken hold yet among investors, as without a Recursion-developed treatment in the market, this is the best validation you could have, is Recursion recapitulating known science. This is the largest, best takeaway from Download Day, and left me personally really excited for Recursion. Lastly, let's talk about a long-shot future state that I could see Recursion getting to someday. The vision is AI-enabled treatment personalization. The process starts with an individual having a disease. Samples from the patient would be gathered. This could be a tissue biopsy for cancer patients, a blood draw, or a saliva test, anything to gather tissue from the affected area of the individual. Their genome could then be sequenced and cells cultured for testing. It would then be split based on if a treatment was known for the disease they are afflicted by. If so, cells would be iteratively tested with different treatments and doses until the optimal minimized dose is found. These treatments and doses are evaluated by AI and happens as soon as the request is submitted. These results could then be verified by an automated chemistry assay for toxicity before being signed off by a doctor who specializes in this area and administered. This would allow both for the best treatment to be administered and for the smallest dose with the least impact to be selected, improving the patient's experience. If a treatment is not known for the particular affliction, which would be very uncommon once it's at scale, then cells would be evaluated using inferential search and the treatments validated using single-cell perturbations. Before being issued, the treatment would be rigorously looked at through an FDA-approved process to quickly implement new treatments that would include software evaluation as well as animal models. However, this is what I think might be possible with the tools Recursion has built and is building. I hope this video sparked your interest in Recursion and can serve as a starting point for further research. I have a few videos on Recursion that will be the first link in the description. Thank you so much for watching all the way to the end, and have a great rest of your day.